Welcome to the deep dive. Today we're tackling something really crucial in agriculture, Anestrus in cattle. Now, that might sound technical, but it's basically a reproductive issue that can seriously hit farm productivity and, their finances too.
Yeah, absolutely. And our mission here is really to unpack it, look at the causes, how it's diagnosed, the treatments. We're pulling this straight from expert sources to give you the clearest picture possible of why understanding this is so vital for animal health and really for farming efficiency.
Okay, let's dive in then. What exactly is an estrus?
Well, at its simplest, it's when a cow isn't showing the obvious signs of being in heat or estrus. You just don't see those behaviors that signal she's ready for breeding.
And the big deal is if she's not showing heat, she's not cycling properly. Which
means she can't get pregnant.
Yeah.
And that directly impacts the number of calves born, the farm's output, everything. It's a missed reproductive opportunity, basically.
Got it. So it's not always the same thing, right? You mentioned different types.
Exactly. We generally split it into two main camps: physiological anestrus and pathological anestrus. Physiological is generally normal. It's tied to the cow's natural life stages, not infertility.
Okay, here you go.
Well, first off, you've got prepubertal anestrus. This is just in heifers before they hit puberty. Their ovaries might develop follicles, but they don't actually ovulate. Often it's down to, low frequency of LH pulses, that's luteinizing hormone, or things inhibiting that hormone.
No, their system isn't quite ready to go yet. Makes sense.
Precisely. Then there's gestational anestrus, super straightforward. If a cow's pregnant, she's an estrus, that's normal.
Right.
And a really important one, especially for beef producers, is lactational anestrus. When a cow is nursing a calf, that whole process can delay her return to cycling.
Ah, the suckling effect.
Yes, but what's fascinating, and maybe a bit surprising, is that it seems to be more than just the physical stimulation of the teat. Research suggests the whole maternal-offspring bond, the calf's presence, particularly its interaction around the inguinal region, that seems to suppress the key hormone, LH.
Wow, so it's like a deeper biological signal prioritizing the calf.
It really seems that way. It highlights this, intricate balance. And finally, under physiological, there's postpartum anestrus. This is the normal recovery period right after calving. The uterus needs to involute, get back to normal, and the body prepares to cycle again.
And how long that takes depends on things like nutrition, the birth itself.
Exactly.
Oh.
Nutrition, suckling intensity, season, breed, how many calves she's had before, whether the birth was difficult, dystocia, all those play a role.
Okay, so that's the normal quiet. What about when it's not normal?
Right, that's pathological anestrus. This is when things go wrong in the reproductive system. It's not just the lack of outward signs. The underlying ovarian activity isn't happening normally either.
So this is a real problem area.
Definitely. Within this, you have true anestrus. This means the cow genuinely isn't cycling. Her ovaries are inactive. But then, and this is a big one for producers, there's subestrus, also called silent heat.
Silent heat. Sounds tricky.
It really is. Because with cystrus, the cow's ovaries are cycling normally. She's producing follicles, hormones, everything's working internally. But she just doesn't show it. Or the signs are so weak, they're missed.
So the opportunity is there, but you don't see it. A hidden loss.
Precisely. You miss breeding windows without realizing it. This can stretch out calving intervals, drag down the whole herd's efficiency. It's a major challenge.
Okay, so we know what it is, the different types. But the big question is why? Why does this happen? It sounds like it could be a lot of different things.
You're absolutely right. It's almost always multifactorial. You're looking at a puzzle with pieces like nutrition, environment, and actual diseases all potentially playing a part.
Where do you usually start looking?
Nutrition is a huge one. Nutritional deficiencies, specifically energy imbalance, are probably the most common culprits behind infertility. Think about that period around calving, and early lactation cows are often in negative energy balance, or NEB.
Meaning they're using more energy than they're taking in.
Exactly. And when that happens, it messes with key hormones like glucose, insulin, IGF-1. Crucially, it slows down the pulse frequency of LH, which is vital for getting the ovaries going again. So first ovulation after calving gets delayed.
Basically, her body's saying, not enough fuel, can't prioritize making a baby right now.
That's a great way to put it. You see it clearly with body condition score, or BCS. Cows that are thin at calving, say a score of 4 or less on that 1 to 9 scale, they just take longer to start cycling.
But being too fat isn't good either, right? Fat cow problems.
Correct. Overconditioning can also cause reproductive issues. Beyond energy, protein deficiency can delay puberty in younger animals and lengthen the days open in cows. And then there are minerals.
Which ones are most critical?
Well, several are important, but phosphorus deficiency is strongly linked to decreased fertility, irregular cycles, even things like cystic ovaries. Copper deficiency is also associated with poor fertility, especially delayed or weak heat signs.
Okay.
Then you have selenium and vitamin E. Deficiencies there can lead to irregular cycles, cystic ovaries too. Selenium might also help reduce uterine infections, which is interesting. And manganese, though maybe less frequent, low levels are linked to poor performance, even abortions.
Wow. And vitamins.
Yep. Vitamin A deficiency can delay puberty, lower conception rates, cause infertility. Vitamin D is crucial for calcium balance, which underpins a lot of reproductive processes.
It's incredible how specific these nutrient links are. What about factors outside the feed bunk, like stress?
Oh, absolutely. Environmental stress is a big one. Heat stress, for instance. High heat and humidity. It reduces appetite, messes with hormone balance, particularly lower LH and progesterone. This leads to poor follicle development and, you guessed it, silent estrus or just very weak signs.
Yeah, I mean, if you're just trying to stay cool, showing strong heat signs is probably low priority.
You got it. And even housing and stocking density can matter. Some studies suggest cows in restrictive tie stalls show less intense heat and have lower hormone levels compared to cows in looser freestall systems. Overcrowding can also just physically limit their ability to interact and show those signs.
Okay, so nutrition, environment. What about actual diseases?
Right, pathological conditions. These are direct problems within the reproductive system or elsewhere in the body. Things like uterine pathology, pyometra is a classic, where the uterus fills with pus and a persistent corpus luteum stops the cycle. Or fetal problems like resorption or mummification. Any uterine infection, really, like endometritis or metritis, disrupts ovarian function.
So trouble inside the uterus silences the whole system.
Pretty much. Then you've got ovarian diseases. Cystic ovarian disease is quite common. Follicles develop but just don't ovulate. Or a persistent corpus luteum, CL, that's the structure that produces progesterone. If it sticks around too long, it prevents the cow from coming back into heat. Rarer things too, like ovarian aplasia or hypoplasia, where ovaries are missing or underdeveloped.
And problems elsewhere in the body can cause it too.
Definitely. Systemic diseases. Think about chronic, debilitating conditions. Lameness is a good example. Pain causes stress. Stress hormones mess with reproductive hormones, and often lame cows don't eat well, leading back to that negative energy balance.
That's all connected.
It really is. You also see complex things like fat cow syndrome or hepatic lipidosis, often overconditioned cows that suddenly decrease feed intake. A severe form is pregnancy toxemia, usually late gestation, especially with twins or fat cows, where the fetal energy demand just swamps the mother's intake. It affects brain function, appetite. It's serious.
Nice.
And don't forget, nutrient toxicity is too much salt if water is restricted, mycotoxins from moldy feed, or even plant poisoning, plus various infectious diseases, things like leptospirosis, or even severe systemic infections that cause neurological signs or just make the cow so generally unwell that reproduction shuts down.
It really underscores how, like you said, a problem that seems totally unrelated, a bad foot, moldy feed can end up stopping a cow from cycling.
Exactly. The body prioritizes survival and immediate health over reproduction when things are out of balance.
Okay, that's a daunting list of possibilities. So faced with a cow that's not cycling, how do you actually figure out which of these is the culprit? It sounds like real detective work.
It absolutely is detective work. You have to systematically explore those potential causes. The starting point is often basic clinical observation, just watching the cows. Are there any subtle signs of heat? Restlessness, maybe a bit of mucus? Standing to be mounted is the classic sign, of course.
But that can be missed easily, especially with silent heat.
For sure. That's why heat detection aids are so important. Things like tail paint, those pressure-activated patches like Camar or Estrotect, chin ball markers on teaser bowls, even sophisticated electronic systems like HeatWatch. They're invaluable tools for catching heats you might otherwise miss.
Okay, so observation first, then what?
Then a thorough physical examination. The cornerstone here is often rectal palpation. The vet can feel the reproductive tract. First job, rule out pregnancy. Believe it or not, that's often the reason a cow seems anestrous.
The most obvious answer sometimes.
Happens all the time. Beyond pregnancy, palpation helps assess the ovaries. Are they active? Is there a CL? Are there large follicles? Or are they small and inactive? You can also sometimes detect uterine issues like pyometra.
And you mentioned body condition scoring earlier.
Yes, BCS is crucial. Using that standardized scale, usually 1 to 5 or 1 to 9, gives an objective measure of the cow's energy reserves. As we discussed, that score is tightly linked to reproductive function. You're aiming for that sweet spot, maybe 2.5 to 3.5 on a 5-point scale. Not too thin, not too fat.
So hands-on exam, condition score. What about looking deeper?
That's where imaging comes in, specifically ultrasonography. It's fantastic. Ultrasound gives you a really clear picture of the ovaries. You can see follicles, identify cysts, luteal cysts versus follicular cysts, diagnose a persistent CL, confirm if ovaries are truly inactive. You can also see the uterus in detail, check for fluid, signs of infection, adhesions.
Like getting an inside look without surgery.
Exactly. And sometimes hormonal assays are needed. Progesterone testing is probably the most common. Measuring progesterone levels in blood or milk is super useful. If progesterone is consistently low, it points towards true Anestrus inactive ovaries. If it's high or cycles up and down, it suggests the cow is cycling, even if she's not showing it. That's estrous.
That helps differentiate those tricky silent heats.
It really does. And while maybe less common for routine field diagnoses, assessing levels of LH or GnRH can also provide insights into the hormonal control mechanisms.
Okay, so with this arsenal observation, palpation, ultrasound, hormone tests, you can usually pinpoint the reason. So then what? How do you treat it and get her cycling again?
Treatment really depends on the diagnosis, of course, but it often involves a mix of nutritional adjustments, hormonal treatments, and managemental improvements.
Let's start with nutrition.
Okay. If negative energy balance is the issue, the goal is to fix it. That might mean increasing energy density in the feed, maybe changing supplements, sometimes adjusting the length of the dry period before calving. If specific mineral or vitamin deficiencies were identified, like phosphorus, copper, selenium, vitamin A, then targeted supplementation is key.
And for something like pregnancy toxemia?
That needs aggressive treatment, 4 fluids, glucose, supportive care. Sometimes, unfortunately, inducing the birth or doing a C-section is the only way to save the cow.
Right. What about hormones? They sound powerful.
They are very effective tools when used correctly. Progesterone treatments, often using those intravaginal devices, CIDRs, are common. They help synchronize cycles, and importantly, they can kind of prime the system in Anestrus cows, making the brain more sensitive to estrogen and triggering the LH surge needed for ovulation.
So kickstarting this cycle.
In a way, yes. Then there's GnRH, gonadotropin-releasing hormone. This directly stimulates the pituitary to release LH, which helps mature follicles and induce ovulation. It's a key part of timed AI protocols like OFF-CINCH, and it's also used to treat certain types of ovarian cysts.
Okay.
And PGF2, or prostaglandin F2 alpha, its main job is to destroy the corpus luteum. So it's used when you have a persistent CL that's preventing cycling, or for certain types of luteal cysts. It basically removes the progesterone block and allows the cycle to restart.
So you're either adding hormones to stimulate or using hormones to remove a roadblock.
That's a good way to think about it. But management is just as important. Simple managemental improvements can have a big impact. Like we said, improving heat detection, watching more closely, using aids effectively. That's critical for catching those silent or weak heats.
Makes sense.
For postpartum Anestrus, especially in beef cows, reducing the suckling stimulus can help. Maybe temporary weaning for a couple of days or restricting suckling times. Improving housing and environment, comfortable bedding, enough space, good footing reduces stress and encourages normal behavior. And basic things like regular hoof care to prevent lameness can indirectly help reproduction by keeping cows healthy and mobile.
And if there's an actual disease?
Then you have to focus on treating the underlying pathological condition. If it's a uterine infection, that might mean antibiotics, uterine lavage. If it's ovarian cysts, GnRH or PGF2, depending on the type. If it's something systemic like nerve damage, a fracture, Downer cow syndrome, treatment is focused on the primary problem, supportive care, pain relief, hoping that resolving the main issue allows reproduction to resume.
It really covers the whole spectrum, from feed adjustments to targeted drugs to basic good husbandry.
It has to, because the causes are so varied.
So as we wrap this up, we've gone through the causes, diagnosis, treatments. What are the absolute key things producers can do for prevention? How do you keep cows cycling reliably in the first place?
Prevention. That's really where the focus should be, because it's always more efficient, more cost-effective than treatment. Number 1, without a doubt, is excellent nutritional management.
Back to that body condition score.
Absolutely. Maintaining cows in that optimal BCS range, that 2.5 to 3.5 out of 5, especially around calving and early lactation, is probably the single most important factor in ensuring they return to estrus promptly postpartum, avoiding both thin and overly fat cows.
Okay, nutrition is king. What else?
Solid reproductive health programs. This means routine vet checks, maybe involving palpation or ultrasound at strategic times like pre-breeding or post-calving checks. The goal is to catch potential problems like uterine infections or cysts early, before they cause prolonged anestrus.
Proactive monitoring.
Exactly, and tied into that is meticulous record keeping and monitoring. Good records are fundamental. Knowing calving dates, heat dates, breeding dates, pregnancy results. It allows you to identify cows that are taking too long to cycle much earlier. You can spot trends in the herd. It's essential for making timely management decisions.
So keep them well fed, check them regularly, and track everything.
That's the core of it. It's about consistent, proactive management based on understanding the animal's needs.
This has been incredibly insightful. We've really gone deep into Anestrus, from the subtle hormonal balances and nutritional needs to the practicalities of detection, treatment, and crucially prevention. It really highlights how complex maintaining reproductive health in cattle is.
It truly is complex. So as you think about this intricate dance of hormones, nutrition, and the environment that governs cattle reproduction, maybe consider this. What other complex biological systems, maybe even outside of agriculture, do you think are just as dependent on such a delicate balance for optimal function, where just one piece out of place can disrupt the whole performance?